My name is Madeline Willis, and I'm a student physical therapist assistant at Jeff State. And today we're going to be talking about necrotizing fasciitis. So necrotizing fasciitis is also called flesh-eating bacteria. It's a rapid spreading disease of the fascia or other body parts. It's commonly seen in the lower extremities due to trauma, IV drug use, insulin injections, skin infections, abscesses, animal or insect bites, or even just surgical complications. And just because it's common in the lower extremities doesn't mean that's the only place it's seen. You can get necrotizing fasciitis anywhere on your body. So there's 3 types of necrotizing fasciitis. This goes along with the age groups that are affected, okay? So type 1 is most common in older adults who have underlying comorbidities such as diabetes. So you're going to see these in those patients, but they've often had no trauma. It just appears when like a sore on their foot doesn't heal up. They'll sometimes be because of necrotizing fasciitis. Type 2 is most common in the younger, healthier people who have a history of trauma, surgery, or IV drug use. So these are the ones that you're going to see from surgical complications. And type 3 is not as common as 1 and 2, but infections occur due to breaks in the skin or open wounds. So most of the time, this is the one that you hear of that people get at the beach in the water because they have open wounds. All right, so now we're going to talk about common diagnosis procedures. So how this is diagnosed. First of all, they usually do a blood culture just to check increased white blood cell counts. They also do a CT scan to look for thickening of the fascia. They look for edema in the adjacent muscles and local gas collections. There's also biopsies taken of the area to test for presence of necrotizing fasciitis. So the medical prognosis is usually not real good for these people. Usually 1 in 4 people die from this infection. If they do survive, they have extreme scarring over their body, and they also have amputations usually. It can be of the arms or the legs, or sometimes just the fingers or the toes. Alright, so next we're going to talk about common medical treatments. So they usually start with antibiotics to help necrotizing fasciitis. They usually want to do immediate surgical debridement of the infected area to try to get as much of that infected tissue out of there as possible to keep from spreading the disease. So they also do the hyperbaric oxygen chamber treatment. This is usually in worst cases scenarios just because it's really intense and you're stuck in a chamber and the oxygen pressure is dropped real low to try to promote healing of the wound. And then they also do IV immunoglobulin therapy for these patients. All right, next we're going to talk about physical impairments, functional limitations, and disabilities of these patients. So some physical impairments include impaired joint mobility, impaired skin, impaired sensation, muscle weakness, and decreased range of motion. Some functional limitations include the inability to perform bed mobility without assistance, to perform transfers without assistance, and the inability to walk. So these patients, all their disabilities are usually just because of their amputations that they've had, but you're still going to be working a lot with these patients to try to regain just any little function that you can. All right, so the next one we're going to talk about is common physical therapy interventions. So I just picked 2, but of course there's multiple that physical therapy are involved with. But I picked 2 that I thought were pretty important. I picked wound care management and rehabilitation of the amputees. So for the first few days, weeks of these patients that have been diagnosed with necrotizing fasciitis, they're not going to be able to do a whole lot. They're usually going to be in bed. Some even are on ventilators, so they can't even get up. But wound care management is super important for these patients. You're going to be working on their dressings, positioning of these patients. You're going to be teaching the family members if the patient is on a ventilator, or if they're not, you're going to be teaching the patients how to position themselves to keep from getting contractures and other pressure sores, because that's the least that they need at this time. So you're going to be checking for infection while you're doing their dressing changes, and you're going to be assessing their pain and sensation just to see how progressive the disease is being. For rehabilitation of the amputees, you're going to be checking the infection, checking for infection in the site where they have just had the amputee. So in the surgical incision, you're going to be dressing that, and you're going to be checking for any infection that could have spread to that. You're going to be preventing contractures, so positioning again, family and the patient education on positioning. You're going to be doing compression wraps for the edema of the residual limb. You're going to be doing functional training, balance training, gait training, teaching them how to walk with a prosthetic, and just patient education overall on the prosthesis, on positioning at home, what to do now that they don't have a leg or an arm, and just how to regain their prior level of function without a limb. Alright, so next we're going to talk about just precautions and contraindications for the therapist. So as mentioned, this disease is very rapidly spreading, and it's also very contagious. So the physical therapist and you as a PTA will be in full PPE treating these patients. And if you're treating these patients in an outpatient setting and they have had an amputation, you're going to be looking for the phantom limb pain and decreased sensation, teaching them how to address not having the full limb anymore, because it usually is not expected that they're going to have the amputation. So the main thing for this is just really keeping their spirits up and trying to be very encouraging that they will regain some of their function back. Alright, the next thing we're going to be talking about is what info could affect treatment, their plans, their goals, and or their progression. So for one, the disease can spread to other body parts like I mentioned earlier, so this could set the patient back. So if you think you're healing one area, then it spreads to another and you have to start all the way over again. If the patient had an unplanned amputation, they could want to give up. They don't have a good mentality because they weren't expecting to lose their limb that day. So it's really important just to keep these patients really encouraged and just to do the best you can to keep their spirits up. You also want to keep in mind that most people really do die from this disease because it is so aggressive and it spreads so fast. So you may not be able to see these patients very long, and that can be really hard on you as a therapist. So the next two slides are some pictures of necrotizing fasciitis. This top one over here is on the chest and down the arm, and he's on a ventilator. I don't know if you can tell. And then this picture over here is more from a surgical complication of a knee surgery, and the wound has gotten infected. And I have two more pictures. This is a person's hand that has it kind of in the web space between the thumb and the first finger and all the way down the back of the hand. And then this one is a foot that it has eaten down all the skin, and it's to the tendons and the muscles in the foot. So I just have some references. It's the same ones that I used in my paper to support this information. But thank you guys for watching, and if you have any questions, just post them in the comments and I'll get back to you. Thank you.